Heart procedure at the leading center in the state. The 300th Watchman was performed at Hartford Healthcare St. Vincent's Medical Center. And joining us now is a member of that team, interventional cardiologist Dr. Edward Carreras with the Heart and Vascular Institute at St. Vincent's. Doctor, welcome.
Thank you so much for having me.
Great to have you. So what is the Watchman Implant?
The Watchman Implant works like a plug that we place into a small outpouching in the heart called the appendage. This is an area where, in some patients, blood clots can form that can lead to strokes. It's particularly designed for patients with a condition called atrial fibrillation, or AFib. In patients with this condition, the heart beats irregularly, and that can lead to blood clot formation. Most patients take blood thinners to reduce their chance of a stroke, but the Watchman procedure is an excellent alternative to prevent blood clots from forming and to prevent strokes.
All right, doctor, can you tell us and show us how it works?
Yeah, absolutely. I'd be happy to. So the procedure is all done through a needle stick in the vein in the leg. There's no surgery, no cutting or incisions. It's all minimally invasive. We take a catheter, which is like a hollow plastic tube, looks like this, and thread it up through the vein in the leg into the heart. We guide it just into this outpouching, this appendage area. And through that tube, we place the Watchman device, which collapses within the catheter and then comes out and latches on to the heart tissue, where we are able to deploy it. It takes about 6 weeks for the surface of the Watchman device to seal off the area as your body forms its own layer of blood cells over this. And ultimately, what we're left with, you can see here in this heart model, is this device inside this small outpouching. It gets entirely sealed off as your body forms those blood cells. And when it does, blood can no longer enter that area and therefore no longer form clots that lead to strokes. The procedure is done entirely under general anesthesia. Patients spend about 1 night in the hospital, go home the next day.
Is this a one-time procedure?
It is indeed, yes. Once the Watchman has sealed off the appendage, it provides a lifetime of protection against stroke, no maintenance of any kind needed, no replacement needed of any kind.
That's pretty amazing. Who's a candidate for this procedure?
The procedure is intended for patients with this condition called AFib, and in particular, patients with AFib who are at a higher than average risk of a bleeding issue when taking their blood thinners. This includes patients who have had prior episodes of bleeding while taking blood thinners, or patients who have a job, lifestyle, or health condition that places them at increased risk for a bleeding issue in the future.
All right, real quick last question. What's the recovery time?
The recovery time is quite minimal. As I mentioned, 1 night in the hospital. For the first week, we ask our patients not to do any heavy lifting. After that, it's back to normal life.
All right, and success rate in 10 seconds?
Our success rate is over 99% here at St. Vincent's in our 300 cases.
Wow. Dr. Edward Carreras, thank you so much for being here, and thank you for the show and tell.
Thank you so much for having me.